Namaste everyone. Welcome back to PharmD Physics. I am Divya, a BPharm graduate and a PharmD student. I am here to make the clinical topic more concise and easy for exam preparation. And in this video, we are going to talk about the classification of hypertension. Earlier, we looked at what hypertension is, its different types, and what it's called and why it's called the silent killer. So this is the next step. So let's dive in. If we talk about the classification of hypertension, there are two major types of hypertension and four less frequently found type. These are basically primary hypertension, secondary hypertension, isolated systolic hypertension, malignant hypertension, resistant hypertension, and hypertension during pregnancy. We will start from the beginning from the two major types, that is primary hypertension. So about 95% of people with high blood pressure have essential or primary hypertension. This condition has no identifiable medical causes. Elevated blood pressure usually begin to appear between age 30 to 50, but can begin at older ages as well. Usually people with essential hypertension have no symptoms but may experience frequent headaches, tiredness, dizziness, or nosebleeds. Although the cause is not known, but contributing factors for essential hypertension may be obesity, smoking, alcohol, diet, and inherited. Now, moving towards our secondary hypertension, that is the second major type of hypertension. So, in secondary hypertension, about 5 to 10% of people with high blood pressure have secondary hypertension. This condition has definite cause. The most common cause of secondary hypertension is an abnormality in the artery supply blood to the kidney. Other causes include airway obstruction during sleep, disease, and tumors of the adrenal glands. Hormonal abnormalities, thyroid disease, and too much salt or alcohol in the diet and drugs can cause secondary hypertension. Certain drugs like OTC medications, ibuprofen, these all are a part of secondary hypertension that can lead to the secondary hypertension. The next is isolated systolic hypertension. In isolated systolic hypertension, in this case, the systolic blood pressure is consistently above 160 mmHg and the diastolic is below 90 mmHg. This may occur in older people and result from the age-related stiffening of the arteries. The loss of elasticity in the arteries like the aorta is mostly due to arteriosclerosis, the Western lifestyle, and it is believed to be the root cause. The Western lifestyle and the diet is believed to be the root cause for isolated systolic hypertension. Now, the next, let's understand malignant hypertension. Malignant hypertension is the most threatening form of high blood pressure. It is marked by an unusually sudden rise in blood pressure to dangerous level. Diastolic pressure often reaches 130 mmHg or higher. However, malignant hypertension may also occur at lower, less alarming levels. If the rise is particularly sudden, unlike other kinds of high blood pressure, malignant hypertension is usually accompanied by dramatic symptoms such as severe headache, shortness of breath, chest pain, nausea and vomiting. Blurred vision and even blindness and seizures can be seen in malignant hypertension. You can just note it down that malignant hypertension is an emergency condition. Okay, so patient with the malignant hypertension must be hospitalized immediately because it places people at immediate risk for heart attack, stroke, heart failure, permanent kidney damage, bleeding into brain and brain swelling. This all can lead to malignant hypertension. And due to malignant hypertension only, a person or a patient is at risk for these disease like heart failure, permanent kidney damage. Our next type of hypertension is resistant hypertension. So if blood pressure cannot be reduced to below 140 by 90 mmHg, despite a triple drug regime of antihypertensive medication called as resistant hypertension. Resistant hypertension may occur in 20 to 30% of high blood pressure cases. It may have a genetic component and is more common in people who are older, obese, and female or have an underlying illness such as diabetes or kidney disease. Next is our hypertension during pregnancy. This is the last classification, that is the last type of hypertension. So hypertension during pregnancy or high blood pressure occurs in 6 to 8% of pregnancies, and in most of these cases it is diagnosed during a first pregnancy. Pregnancy can cause high blood pressure due to hormonal changes or from a serious complication. And that serious complication of pregnancy is known as preeclampsia. In a preeclampsia condition, it causes tightening of arteries throughout the mother's placenta, which can lead to hypertension during pregnancy. Here we have completed the classification of hypertension. So, thank you for watching. Please like, share and subscribe, and remember to hit the bell icon to get notification. If you have any doubt or question, feel free to comment below or reach out on Instagram and Facebook. We will respond and discuss them together. Thank you.